আপনারা দেখছেন টকিং পয়েন্ট।
সৌজন্যে মাহবুবেন কো অ্যাকাউন্টেন্টস।
Welcome to the show. Our guest today is the CEO of BRAC UK. Mary, thank you very much for being with us. And we were talking about focus on women and the health and how BRAC is going about it. Give us examples of how do you go about focusing your facilities, women in Bangladesh, women in African countries, and their health issues, FGM and others.
Okay. So because over half the population is women, we believe that it's really, really important to empower them. And so in many of our programs, our capacity building is focused almost entirely on women. So in our schools across Asia and Africa, our teachers are all women. They are local people from the communities that we train up as teachers.
What sort of level of schools? Like primary school or
primary
not
schools.
Secondary?
We don't do much. We do teacher training in secondary school, but the schools that we run are generally primary and early childhood education, so pre-primary.
Right.
Yeah. So they're the schools that we run, and it's women teachers there, local women from the communities who then become trained and become role models for the girls in the schools, and also role models in their communities. They become much more confident and articulate. We take the same approach with health. So our community health promoters are women. Again, well-trained, initial training and then monthly refresher training, so they become very knowledgeable over a long period of time.
What sort of incentives do these teachers and these trainers get?
Okay.
I mean,
So
do they get paid or?
The teachers get a small honorarium. The community health promoters at the basic community level do not receive a salary, but they receive other incentives. So for example, they have a bag of resources, basic medicines that they can sell in the community for a small profit.
Right.
And so that is an incentive for them. They also get incentives, for example, for referring pregnant women to government health facilities when it's needed. For
does BRAC run hospitals?
Not big hospitals.
Clinics?
Some clinics, yes, we have clinics, particularly in Bangladesh. Yeah, in Bangladesh we have clinics, not so much in Africa. Yeah, so we work very much with the local government facilities and also private sector facilities, and we have very strong relationships. We set up agreements so that our referrals are dealt with quickly and efficiently.
Oh, great. During the break we were talking about an article in this British medical journal, Lancet.
Yes.
What was it about? And I think BRAC features in that article.
So the Lancet focused on the huge achievements in health in Bangladesh. I mean, some people describe it as a miracle. The fact that maternal mortality has dropped so much in recent decades, that infant mortality is also decreasing, fertility is also decreasing. I mean, it's just over 2 now, which is great compared to what it was several years ago. And when you have smaller families, you have children that are better cared for. So the Lancet is the medical journal, had lots of several articles which describe the huge success in Bangladesh, really big success in terms of its health progress in terms of health.
The success of BRAC's operations, isn't
Well,
it?
BRAC has been a huge part of that. I mean, it's not just BRAC, but BRAC has 90,000 health workers throughout Bangladesh. So it's obviously had made a huge contribution to that, particularly at the community level.
So are you working in collaboration with the government health workers?
We have partnership arrangements with government services. So, for example, we have a big program in urban slums now. What we found is that pregnant women were reluctant to go to government facilities. They didn't feel comfortable going. And so there was higher levels of maternal mortality. We now, in the slum areas, we have set up what we're calling birthing huts. So safe, clean places where women can go to give birth. They also go there prior to giving birth for discussions and groups to learn about how to take care of themselves when they're pregnant and when they've had their baby, and how to take care of their baby. So they learn a lot. Then they go to these birthing centres to deliver their babies. If there are problems, they're then very efficiently referred on to government services. So we have these very close working arrangements, very positive working relationships with government
provides,
services.
suppose they need medicines, who provides the medicines?
Well, what we're finding now is that because the family size has decreased so much, and because people are therefore valuing their children much more than they used to, they are prepared to pay small amounts for their health care. If people really can't pay, then BRAC will step in. But we're finding more and more that people are having just 2 children, and they really want the best for their children.
Are these medicines cheap for them to afford, or they're pretty expensive?
Some medicines are very expensive. I mean, it depends on how poor you are, doesn't it? It's a relative thing.
Yes.
But
I know that medicines produced in Bangladesh, I mean, and they produce a lot of medicines.
Which are much cheaper.
Which are much cheaper.
Yeah. And the other thing we are doing in our programs is encouraging people, especially pregnant women, to actually save for the birth,
Right.
so that they have money. The money that they need, should they need medicines or should they need medical care when they're giving birth,
Right.
so that they become self-sufficient through that process.
Right. We were talking about focus on women and the grassroots empowerment. But before we go on to that, you see, this is a very tickling and serious question of FGM, female genital mutilation, and practiced in many countries in Africa, and somehow it has also been imported into the United Kingdom. Are you aware of it? Is BRAC dealing with it, or?
Absolutely, we're totally aware of it. I mean, as you know, the British government is taking it very seriously now, both in the UK, because it's happening in the UK, and in countries around the world, and in fact investing quite a lot of money.
Let me make it clear, see, this has nothing to do with religion, you see.
No, absolutely not. Absolutely not.
It's against the principles and practices and the preachings of Islam. See.
Absolutely.
So it should not be thought that it has anything to do with Muslims. No. It is banned, it's unclean, and it's torture, it's against human rights and
completely against human rights, completely against human rights. And it traumatizes girls for life. And causes them pain and discomfort, very often serious medical problems. You can have hemorrhaging when you're cut. So huge problems for girls, and absolutely needs to be addressed. It's total abuse, and it's child abuse quite often. It's real child abuse, because for many girls who are cut, they are very, very young, and have absolutely no say in it.
Yeah, well, the unfortunate thing is that this is happening in this country too.
It is happening.
And people are getting away with it, see.
Yes.
This grassroots empowerment, what does it mean really?
So
people at the grassroots will be given more powers, you see. But how do you give them power? You make them more aware of what is available, what they can do.
Yes, absolutely. I think people will only have power when they have education. I think education gives people power, when they know, when they understand, when they're literate, when they're numerate, when they are able to take control of their lives, then they have power. Confidence is another important element of this empowerment. One of the things that one of BRAC's programs is around empowering adolescent girls. And the way that we do that is by setting up clubs, we call them. They're safe spaces where girls can go. This is girls between the age of 10 and 19, depending on the different countries. At these clubs, the girls learn life skills. So they learn about things we've just been talking about, FGM, sexual health. They learn how to be confident, they learn about birth control, take care of themselves. They also learn livelihood skills. So if they dropped out of school, which many of them have.
Do you also teach martial arts?
It's needed, but we don't teach it, as far as I know. Yeah, but they do learn life skills, so that if they've dropped out of school, they can then take up a small business. We also give them small loans. And what we notice about these girls is that they do become very much more confident and articulate. And when you were talking about empowerment, this is a really strong way of empowering young girls.
Health and education, see, we have been talking about health all this time, see, but making them aware of their health or do these good health practices, is it enough if we don't have clinics easily available, if we don't have hospitals easily available, if we don't have medicines easily available? We're talking about health is very good, it's just like reading a book, but not being able to practice. See? And then, of course, education. See, primary education is obviously very necessary. You can't go on to the secondary and tertiary education without primary. See? But is primary education enough? I know you have BRAC University.
We do.
But there's a gap in between primary and the university education.
I mean, what we're talking about
is... You have left it for the administration to take care.
I think it's what we're talking about is different levels of poverty. So if you go to a country like South Sudan, which has been ravaged by 20 years of war, you won't find clinics, you'll find very few hospitals.
You did spend some time in South Sudan,
Yes, BRAC has a program.
Do tell us and our viewers, see.
Okay.
I'm interested.
Okay, so I would say that South Sudan is the poorest country that I've ever visited, and I've visited a lot of countries in Africa. It's been completely destroyed by 20 years of war, and there's still some fighting at the moment, as you've probably heard. So there the infrastructure is completely destroyed. So there aren't many government schools. The government has little resources to actually provide basic services. People have little access to clinics, but you can do quite a lot around prevention. So educating women how to take care of their families, things like oral rehydration, as we just watched on the video, cleanliness, washing your hands, simple basic things like that, how to spot malaria. So we can do preventative work, and we do a lot of that. We have community health workers who go door to door, talking to people about how to look after themselves and their children, and how to treat basic ailments. But it's when things get more complex that in many countries there is a huge problem that is very difficult to do anything about.
But you do send out medical doctors in some countries, don't you?
We from Bangladesh, you mean? We have some programs in some countries in Africa, and we have brought doctors from Bangladesh. But what BRAC is trying to do in these programs is actually build the capacity of the local people to run those programs. We don't want them to be run from elsewhere. So initially there were people with specific skills who were coming from Bangladesh. What we're trying to do now absolutely is build up the capacity of the local people so that they take over the running of the programs, the management of the programs, and the decision making about what happens in the programs, because they are the people who know best what is needed for their own people.
Right. So you use the local resources, manpower and otherwise. We'll have to take a break, and then we'll come back and talk further about BRAC and BRAC's activities. Thank you, viewers, for being with us, and we'll have to take a commercial break at this moment in time, and then when we come back, we'll continue the discussion. Don't go away. Come back soon.
আপনারা দেখছেন টকিং পয়েন্ট।
সৌজন্যে মাহবুবেন কো অ্যাকাউন্টেন্টস।